Hi, Christy. I just wanted to give you a little bit of feedback about the interview, if that's okay.
Okay.
Great. I thought you did a really nice job of kind of engaging him and introducing the problem of drinking and in connection with his, doing the screening and connecting it with his blood pressure.
Okay.
So I thought that went very, very well. How do you think it went?
I think it went okay. I think I screened for everything I needed to screen for.
Do you think anything could have been done better, or did you have any sense of what he was doing? Was he going along with you on everything?
You know, I'm not sure that he realized it was as big of a problem as I thought it was.
Right. I think you were a little ahead of him on that.
Mm-hmm.
So again, what we try to do here, you try to do the screening, you know he's drunk a little more than he thinks he's drunk.
Mm-hmm.
So you wanted to kind of just talk with him and maybe get him to be concerned a little more before you tell him that you're concerned. So I would ask a little bit more maybe about were there any negative effects of any of your drinking at any time? Something like that might get him engaged in thinking about that. Even after you gave him the information, which was really good, by the way. You did a very nice job talking about the liver and how the processing of that and the alcohol contributing to the high blood pressure. I thought that was really well done. But you might want to get him to ask him a little bit more and wait for a little more of an answer about, you know, what do you think about that? And get him to kind of talk a little bit about, well, it might be an issue or something like that. If you can get a little bit, just a little window of concern, then you have a better chance of him thinking, well, maybe I need to change that behavior. So you did very well on the screening. You did very nicely in terms of congratulating him about his efforts around smoking and other kinds of behavior changes that he did. So we like to see that. He wasn't very ready. And so there, I think you'd have to do a little more work to kind of get him ready. Just ask about that and say, you know, I'm still seeing a connection between your drinking and the possibility of it contributing. To get him engaged, you might also want him to do a little bit of an experiment. Okay. So you kind of say to him, look, I don't know, you're not convinced really that the alcohol is really contributing to your high blood pressure. I think it might be. Could we do a little experiment and test this? Can you maybe just in the next couple of weeks cut down a little bit on the drinking that you do each night, and then we can kind of see each other back again in a month and check and see if it might be affecting your blood pressure.
Okay.
And he might buy that goal a little bit more and kind of maybe go with you on that a little bit more. Reflect what he says. So at one point I think he was saying something about, well, you know, I don't drink any more than any other people. Then I would kind of, well, it might help, it might contribute to your high blood pressure, but you have a lot of people around you who are drinking the same amount as you, so it doesn't seem to be a problem. Mm-hmm. And you just lay it out so that he kind of has to do a little more reflecting on that and talking to you about that. Otherwise, I thought you did a really nice job. It's a very respectful interview. The only thing is getting him on board a little more, engaging him a little bit more in the solution. And convincing him a little more that there's a problem. So I think you used a number of the good techniques that we have taught you in terms of the brief intervention stuff. So I thought you did a very nice job there with the affirmations and introducing it and doing the screening and screening all the behaviors. That was very well done. The only thing I think we need to keep working on is kind of engaging the patient a little bit more in the solution and maybe even in seeing the problem as much as you do. Because he was just not quite there with you. Yeah. So whatever strategies you could do to kind of get him involved, get him to talking a little bit more about his drinking, and then maybe negotiating with him about the goal in a way that he can buy into, like we talked about. That'd be great.
Okay, thank you.
You're welcome.